what I have found, I think we all know this, is that physicians tend to be risk averse. That's very common among physicians. They've put a whole lot of effort into their education, a whole lot of money into medical school, and understandably they're risk averse. They want the paycheck coming in, they want the nice house, they want the nice car, and they don't want to step too far out of that mold because they don't want to jeopardize that, and there's nothing wrong with that. But the problem is everybody just keeps complaining. It's getting worse and worse and worse. Someone has to step out and at least try something. And that's why people like Josh and Steve are so important. And because what I realized was that the changes that have to be made have to kind of grow out of the primary care doctor, getting back to this concept of doctor and patient. And that is I hate that phrase, but sacred bond. It's way overused. But the idea that that's what matters is that bond between the patient and the doctor. They trust their doctor and they want their doctor to help make decisions. They want their doctor to help them guide their care. The patient does not care that their doctor knows everything in the world. They do not care that. What they care about is that they trust their doctor and that if he doesn't know something, he's going to help them get to where they need to go. So that's where I started. I said, okay, let's start the clinic. Let's move to a direct pay model, a DPC clinic, fine, if that's what you want to call it. That's where we started. But I wanted to apply the DPC clinic model to large groups. And I said, this is where the magic is going to start happening. So I just kept pushing and pushing to get groups to think about this. And I realized then at that point that the groups would go, well, what about surgery? What about orthopedics? What about cardiology? What are you going to do about all that? And I said, I'm going to fix all that. And that's amazingly here in northeastern Wisconsin. I think the first gift from God was we had. Am I allowed to say Can I say names of things? I'm not sure. So the first gift to us was Green Bay ER and Hospital. Independent emergency room and hospital just dropped out of the sky. I always say it's like I say it's like the Wizard of Oz when the house just comes down, and it just lands here in Green Bay. And they called me up before they even put a building up, and they said, "Hey, we'd like to associate with you." And I said, "That's great." And I said, "Who the heck told you to put this here? You landed this thing in the middle of Fort Knox. I don't know why you did it, but all I know is I'm glad you're here." So all of a sudden, I have a contract with Green Bay ER, and we have a place now to send our patients for urgent care ER stuff on a contracted basis, not going through insurance. And holy cow, that worked out. And all of a sudden, patients are getting used to going there, and the checks are being written to each other, and it's working, and it's saving not only a whole lot of money, but it's getting people way better emergency room care when they need it. So that was, again, a blessing from God. Well, then along comes these guys named Josh and Steve, and they said, "Hey, we want to put up this independent surgery center near the big hospital in Two Rivers." And I said, "What?" And they met, and next thing you know, now I have access to direct market, GI services and pain management services, and now general surgery. Like I said, there's a reason why this is all coming together, and it's because the need for it is just so overwhelming. People want to get back to a world of quality and price. They don't mind paying money if they know they're getting a good product. Just like when you go to buy tires, you want to walk into a store and say, "Hey, I want that tire there. That's the tire for my car. It's going to work. I don't need this $1,200 tire. I don't want the $50 tire. I want this good one right here." That's what they want. And, there's a lot of value to that.